Let us continue the oral cavity, and in this in part 2, in the second part, we'll continue talking about the floor of the oral cavity, especially the most important structure there, which is the about the tongue. We mentioned that the tongue represents mainly the or forms mainly the floor of the oral cavity proper. So let us dig deep in the tongue. Well, guys, I would like you to know that the first of all that the tongue is a muscle, striated a muscle that's covered with a mucous membrane, as you see. So furthermore, we can divide it into 3 parts, or 2 parts, but I mean anterior 2/3 and posterior 1/3. So this is the anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue. The anterior 2/3 of the tongue is located in the mouth, but the posterior 1/3 is located or lies in the pharynx. So we can divide it in like in different way. You can say, okay, the tongue has 3 parts. It has a root, body, and apex. So the root, before talking about the root, body, and apex, well, I would like to mention that the tongue has a couple of functions, including its function in normal articulation of the jaw and the manipulation of food and swallowing of the food and the production of coarse normal speech. So guys, let us have an idea about the root, body, and apex. So the root is the, I would say, the most fixed part of the tongue, extended between the mandible and the hyoid bone. Look at it. And also extend to form the posterior 1/3 of the tongue, the pharyngeal part of the tongue. The body, guys, and the apex, the most movable part of the tongue, and the body represents the anterior 2/3 of the tongue. And the apex is a part, I would say, of the body, and the apex is always, like most of the time, against the incisor teeth. So look at the right figure here, guys. This is the anterior 2/3 of the tongue, and this is the posterior 1/3. So keep in mind, guys, that the upper surface or the oral, look at the upper surface of the tongue. This one is known as the dorsal surface of the tongue. But this, or I would say the inferior part, is the ventral surface of the tongue. So this is the dorsal surface of the tongue. The upper one is the dorsal surface. However, look at the sulcus terminalis here. That divide. This is a sagittal section of the tongue, right? So the sulcus, there is a sulcus here. The sulcus terminalis or terminal sulcus divides the tongue into, again, anterior 2/3 and posterior 1/3. Look at the superior view of the tongue. Here is the anterior 2/3 of the tongue, and here is the posterior 1/3 of the tongue. Of course, divided by a sulcus. This is the terminal sulcus. Look, guys, here I will erase this, and I want to show you at the tip of the terminal sulcus we have a small pit, which is a foramen known as foramen cecum. It was a remnant of thyroglossal duct. This is the duct and this is the opening of it, but after a while it's obliterated and closed, but still we have a remnant small pit that indicates an old foramen was there. So you will learn more about the thyroglossal duct in the embryology. Okay, now let me give you guys an idea about the mucous membrane of the tongue, although we will talk in details about the mucous membrane in the histology lecture. But for now, it's good to know that the mucous membrane of the tongue has mainly three types of papillae. Some of them known as fungi-form papillae because it looks like a mushroom, and another type of papilla known as filiform. Fili, that means like threads, right? Distributed, of course, across the anterior to the head of the tongue, and anterior, just anterior to the terminal sulcus. This is a terminal sulcus, just anterior to it. There is about 8 to 12 valate papillae, which is like a broad, as you see here, with constricted base. So if you look to the mirror, you will see the fungiform. You see mainly, very obviously, valate papillae here, which is, you will know that, of course, behind it is the posterior 1/3 of the tongue. You cannot see it, which is the pharyngeal part. But there is no papillae in the posterior 1/3 of the tongue. Instead, there is a kind of, if you notice, a kind of nodules here, lymphatic nodules that aggregate to form the what known as lingual tonsils. Tonsils, you know why tonsils, but lingual, which is related to the tongue. You want to say lingual, that means something related to the tongue. Again, on the right side, you'll see the lingual tonsils here, guys, forming the posterior 1/3 of the tongue. Now, still we are talking about the floor of the mouth. Let us raise our tongue up. When you raise your tongue, try to look in the mirror while you study this couple of slides. You will notice, first of all, that the mucous membrane on the undersurface of the tongue is really smooth, right? And in the midline, guys, of course, you are raising your tongue up. When you look here in the midline, you will see like a fold of a mucous membrane that connects the floor of the mouth. This is the floor of the mouth by the ventral surface of the tongue. This fold of mucous membrane known as frenulum of tongue. So this is the frenulum of tongue. Now, okay, let me erase this. Now, look at follow the frenulum of the tongue that's located in the midline all the way down until you reach the floor of the mouth. You will notice that in the floor of the mouth, on each side of the frenulum, there is a small opening here for the opening of submandibular duct. Yes, we started at the beginning of the previous lecture talking about salivary glands. That was, we just mentioned the parotid gland, and now there is something called submandibular gland, and there is a duct for them. These are two ducts for submandibular. We'll talk more in details in the next time about salivary glands and duct and everything. So, however, this is the second submandibular duct. They open nearby the midline, close to the frenulum of the tongue close to the abyss. Let me show you here. This is the frenulum of the tongue, and this is the floor of the mouth. So near the floor of the mouth and on each side of the frenulum there is a small opening here, those for opening of submandibular ducts. Now, not just that, but also, let me show you, also there are many, from between 8 and 20 openings of sublingual openings, I would say, which is openings related to the sublingual gland. So these are the openings of ducts from sublingual gland. So now we mentioned the submandibular duct and the gland, and now we have sublingual gland and openings. They are between 8 up to 20 on each side. Look at it here and here. Don't be confused, guys. Again, these are openings, guys, because the sublingual gland is below this fold and they open directly here through small openings. And remember, we have, so these are sublingual opening or opening of sublingual gland, and here's like 2 openings for submandibular duct. That, of course, they come from the submandibular gland. So, what else we have, guys? Again, the floor is smooth. The ventral surface or the under surface of the tongue is smooth. No papillae, guys. And again, this is the fold of a mucous membrane on the ventral surface of the tongue that's known as a frenulum of the tongue, and just lateral to it. Still, look at the mirror and raise your tongue up again and look lateral to the frenulum of the tongue. You will see like a bluish or greenish color, which is related to the deep lingual vein. So these are deep lingual vein and artery, of course. Most obviously, you will see the deep lingual vein. So yes, and lateral to the lingual vein, guys, you will see a kind of, again, a fold also of a mucous membrane that known as Plica fimbriata. Plica fimbriata, or fimbriated fold. You can say fimbriated fold, or you can say Plica fimbriata. So I'm not sure if we have here. No. Yes, here is obvious. This is the frenulum of the tongue. This is the deep lingual vein on the right and on the left. And lateral to it, there is again another fold of a mucous membrane, fimbriated fold here, fimbriated fold here. Excellent. Look at the opening of the, close to the opening of the parotid duct here. Look as like there is like kind of a stone in this case known as calculus formation here, in which there is a stone can be palpated in the duct, which is just beneath or under or below, I mean, the mucous membrane of the floor of the mouth. So the patient will kind of suffer from like swelling under or below the body of the mandible, where is the submandibular gland located. More details in the next lecture about those salivary glands, but let me give you an idea here in this figure. Look at this is the mandible, guys, that they cut it from here and cut it from here to expose the sublingual gland and submandibular gland. You know, submandibular gland is a kind you can see it's like kind of two parts here, and most importantly, during operation, guys, you have to remember that the duct of the salivary, or the duct of the submandibular gland is crossed by a lingual nerve. More details in the next lecture again, guys, but please keep it in your mind that the duct of the submandibular gland is crossed by this nerve that's known as lingual nerve, which is important nerve. We finished the mucous membrane of the tongue. Now what about the muscles of the tongue? We mentioned that the tongue is formed by striated muscles covered by a mucous membrane. Okay, we are done with the mucous membrane for now. Still, we have to talk more about that in the histology, but let us shift to the muscles of the tongue. Simply, guys, and from the end, we have two types of the muscles in the tongue. We have intrinsic muscles and extrinsic muscles. Intrinsic muscles, guys, they are restricted to the tongue and they are not attached to bone, and they are longitudinal. Look at it here, guys. When they are ran in this shape or in this way, when you cut it like this, you will see like a dotted lines here, as you see. So this is the superior longitudinal intrinsic muscle, because we say superior because we have inferior as well, right? Inferior longitudinal. Furthermore, look at it here, guys. There is a fibers moved in that way. On the other hand, there are fibers in that way perpendicular to it. So we have vertical and transverse also fibers. So the intrinsic muscles, guys, are longitudinal, transverse, and vertical fibers, and all are innervated by cranial nerve number 12, that known as hypoglossal nerve. Hypoglossal nerve. The function mainly of intrinsic muscle is to change and to alter the shape of the tongue itself while it lies in the mouth cavity. So changing the shape of the mouth is the shape of the tongue, sorry, is the responsibility of the intrinsic muscles. Okay, let me show you here again. This is a coronal section of the tongue. This is a superior longitudinal, inferior longitudinal, transverse, and vertical. Look at this fiber here and fiber in that way. So vertical and transverse fibers. Okay. Let us now shift to the extrinsic muscle, like for example, genioglossus muscle, hypoglossus muscle. Look at it here. We have 4 pairs of extrinsic muscles. They are attached to the bones and soft palate. I think you remember this muscle, the palatoglossus muscle. We talked about it yesterday. That originates from the palatine aponeurosis, from the soft palate. You remember the soft palate, right? So that's covered by palatine aponeurosis. So from that aponeurosis, there is a muscle originated from there and moved down to the lateral dorsal surface of the tongue to be obliterated there. So this muscle is the palatoglossal muscle. So, which is easy to remember that. Also, we have a muscle that originates from a styloid process of temporal bone. This is a small bone, a small process of the bone related to the temporal bone. From it, there is a muscle, guys, here known as stylo, because this is styloid process. Styloid process of temporal bone. So there is a styloglossus. Always you will see glossus, palatoglossus, styloglossus, genioglossus, hyoglossus, right? Glossus, that means something related to the tongue. So again, this is the styloglossus muscle. Inferiorly, guys, we have a fan-like shape muscle, that's known as genioglossus. Genio, it means something related to the mandible and chin. So genioglossus and hyoglossus, because it originates from this bone, hyoid bone, right? So this muscle is the hyoglossus muscle. Interestingly, guys, and you know this, not just the intrinsic muscle of the tongue are innervated by hypoglossal nerve, no, but also the extrinsic muscles of the tongue also innervated by hypoglossal nerve as well, the cranial nerve number 12, as I mentioned, except the palatoglosssus. I think you remember from the last time we said that the palatoglosssus muscle is innervated by the pharyngeal plexus, exactly from the vagus nerve fibers, because we mentioned that the pharyngeal plexus formed by cranial nerves number 9, 10, or fibers from cranial nerve number 9, 10, 11, and sympathetic ganglion. And here's the vagus nerve, guys, gives a fiber to participate in the pharyngeal plexus that innervates the palatoglosssus muscle. Sorry. Here's, guys, again, let me show you the function of each muscle with this figure. Let me start with the easier one that you remember from the last time, which is the palatoglosssus. You remember this muscle from the soft palate. This is the hard palate. Look at the bone, hard palate, and posterior is the soft palate. From the soft palate or palatine aponeurosis, this muscle that creates a palatoglossal arch inserted into the dorsolateral surface of the tongue. So when it contracted, it elevates, right? Just imagine, elevates the dorsal or the posterior portion of the tongue, and at the same time depresses the soft palate as well. This is the palatoglosssus muscle. So elevates the posterior surface of the tongue. What else elevates the tongue? There's a styloglossus. This is the styloid process, and this is the styloglossus muscle. This is styloid process, guys, of the temporal bone. This is a temporal part of the temporal bone, and this is a styloid process from which, like, a couple of muscles, including our muscle that we talk about, the styloglossus muscle. So when it's contracted, because here is the origin is fixed, so it will elevate the tongue, not just elevated, and also retracted it to the back. Excellent. What else? We have inferiorly an important muscle. Please remember this muscle because clinically is important, and it's used to test of the hypoglossal nerve. It's known as genioglossus muscle. It's like a fan shape زي شكل مروحة, right? Fan shape originates from the superior mental spine, just superior to the geniohyoid muscle. So genioglossus originates from here, and from the superior mental spines of the mandibular symphysis, and inserted into the with the tongue, and also part of it attached to the hyoid bone, right? This is the hyoid bone. However, when this muscle is contracted, it will depress the tongue down, right? Depresses the tongue and protruded it to the outside. So opposite to the styloglossus that retracted it and elevated. So still we have the last one, which is pretty easy, the hyoglossus that's attached to the hyoid bone, this muscle, and to the tongue. So it's I think if you imagine when it's contracted, it will depress also the tongue. So let me summarize it to you guys. So we mentioned that we have palatoglossus here. I'll use another pen. Okay, palatoglossus that elevates the posterior 1/3 of the tongue. We have hyoglossus that depresses the tongue, but we mentioned the palatoglossus elevates the tongue, right? And we have genioglossus, the fan shape, that depresses the tongue and protruded it outside. But opposite it is the styloglossus, this one, that elevates the tongue and retracted it to the back. All muscles or extrinsic muscles are innervated by hypoglossal nerve, except the palatoglossus, which is related to the soft palate and innervated by pharyngeal plexus by fibers from vagus nerve. Now, this is a very important slide. This is really very important slide, and you have to expect always to get an question in the exam about the sensory innervation of the tongue. Listen, that I'm talking about sensations. We have two types of sensations now for the tongue. We have general sensation and we have taste sensation. Keep it in your mind. We have general sensation and we have taste sensation. And also you know already that the tongue divided into anterior 2/3 and posterior 1/3. Excellent. This will make the memorizing make it like very easy to memorize the sensory innervation of the tongue. Excellent, guys. Let us start with the anterior 2/3 of the tongue. Simply, you have to remember two nerves: cranial nerve number 5 and the cranial nerve number 7. Let us start with that. And regarding the posterior 1/3 of the tongue, you have to remember cranial nerve number 9. So we have 5 and 7 anteriorly, and posterior 1/3 we have cranial nerve number 9. Also, of course, there's number 10, but let me just explain the I would start with the third, with the 3 nerves, those. Okay, so for the anterior, for the general sensation from the anterior 2/3 of the tongue, those carried, guys, by lingual nerve, which is a branch of mandibular nerve, which is a branch of cranial nerve number 5, the trigeminal nerve. Look at it here, general sensation from the anterior 2/3 of the tongue, carried by lingual nerve. Look, this is the trigeminal nerve, cranial nerve number 5. This is the ganglion. It gives 3 branches, V1, V2, and V3. That's why it's known as trigeminal nerve, right? 3 parts. The ophthalmic, the maxillary, and the mandibular. From mandibular, there are 2 divisions, anterior and posterior divisions, with like a couple of branches. And from the posterior division of the trigeminal nerve, one branch, of course there are 3, one of those branches, very important branch, known as lingual nerve. This lingual nerve will carry the general sensation from the anterior 2/3 of the tongue. Okay, that's why I mentioned number 5. Okay, that was general sensation. But what about the taste from the anterior 2/3? What about the taste sensation? The taste carried by cranial nerve number 7 through the chorda tympani, right? A branch of nerves or nerve fibers carry the taste sensation. These fibers known as chorda tympani, which is related to the facial nerve, which is a cranial nerve number 7. Of course, when we talk about the taste sensation, we have to exclude the valate papillae, right? Those papillae, valate papillae, we have to exclude them, right? Okay, so we have a cranial nerve number 5, for general sensation, and number 7 for the taste sensation from the anterior 2/3 of the tongue through the lingual nerve and chorda tympani. Very important. Now, what about the posterior 1/3? Simply, guys, the general sensation and the taste sensation from the posterior 1/3 of the tongue is carried by, of course, including the valate papillae, carried by cranial nerve number 9, glossopharyngeal nerve. So the general sensation and taste sensation, both carried by one nerve, which is the cranial nerve number 9, glossopharyngeal nerve. Of course, including the valate papillae. Now, the general and taste sensation also from the root of the tongue and epiglottis as well, which is a part of the larynx, is carried by, both are carried by vagus nerve, cranial nerve number 10. Very simple and very easy to word and very important. Okay, here is another very important clinical point. I think you mentioned, guys, the last tooth that we have, that known as wisdom tooth or teeth, because we have 1, 2, 3, 4. So I mean the third molar. Look at it here in the inferior figure. This is the lower wisdom tooth, the lower one. I'm talking about the lower, not the upper one. The lower wisdom tooth, the third one. Look at it, it's very close. It's mostly in the back, and for a reason or another, most of people like extracted, and because I think they said that there is no, or there is a little function for it. Anyway, I'm not expert in that field, but most importantly, it's related. It's liable to damage because it's very close to the lingual nerve. You remember the lingual nerve that we mentioned earlier? This is trigeminal nerve, cranial nerve number 5, with the mandibular division that gives a couple of 3 branches. One of them is the lingual nerve that carries the general sensation from the anterior two-thirds of the tongue. It's very close to the third molar tooth. So during the extraction, guys, there is an tendency to injure this nerve. It does happen, especially when there's a kind of a clumsy extraction during the extraction of the third molar. So this is important clinical point, especially for dentists. Let us shift to the blood supply of this important structure, the blood supply of the tongue. Well, I would say mainly, and from the end, the main artery that supplies the tongue is the lingual artery. Well, as you see here, that the lingual artery is a branch of external carotid artery. This is the external carotid artery, and this is the lingual artery. First of all, look to the lingual artery. First of all, it's located deep to the hyoglossus muscle. This is the hyoglossus muscle. So it's located deep to it. Deep to it, that means medial to it. Why? Because the hypoglossal nerve located lateral to it, lateral to the hyoglossus muscle. Anyway, there's another story. We'll talk about it in the next lecture. But let us follow the lingual artery and the branch of it. So, guys, the lingual artery gives mainly a couple of branches. Most importantly, look at these dorsal branch, because you know this is the tip of the tongue and this is the dorsal of the tongue. So these branches are the dorsal lingual branch, right? And it gives also not dorsal but deep, because look at it, it goes deep in the tongue, deep lingual artery. So the deep and the dorsal lingual artery as a branch of lingual artery, in which you know that the lingual artery is a branch of external carotid artery. So the dorsal lingual artery, guys, supplies the or those branches supply the root of the tongue, right? While the deep lingual arteries supply the body of the tongue. Now let us follow the venous drainage. Again, look at it here. The dorsal, let me use another pen. Okay, the dorsal lingual vein and the deep lingual vein, they drain to form and they unite to form lingual vein. And of course, you know, guys, maybe you know from the cardiovascular system that the lingual vein and the facial vein and the retromandibular division, they all unite in this trunk, which is a common trunk for all of them, that at the end drains into the internal jugular vein. This is the internal jugular vein. So guys, that was about the blood vessels, and now let us talk about the lymphatic drainage. Why the lymphatic drainage is important? Because in case of carcinoma of the tongue, we have to know where is the most suggested or mostly the metastasis will be where is the location of metastasis of the cancer or cells. So we have to know that the tip of the tongue, this is the tip of the tongue. Again, let me draw the tongue to you here. Okay, this is the anterior 2/3, I would say, and this is the posterior 1/3 of the tongue. So the tip of the tongue drains into submental lymph nodes. Those, you have an idea about it. So the submental, just under your chin here in the front, these lymph nodes known as submental lymph nodes. But the body of the or the rest of the anterior 2/3 of the tongue, forget now the tip, they drain into submandibular lymph node and deep cervical lymph nodes. Also, the posterior 1/3 of the tongue drains into deep cervical lymph node. Again, let me erase it and make it like easier for you guys. So the tip, let us talk about the tip of the tongue and the rest of the anterior 2/3 of the tongue and the posterior 1/3 of the tongue. So the tip of the tongue, it drains into submental lymph node. Excellent. Now, the rest of the anterior 2/3 of the tongue, it drains into submandibular lymph nodes. Somebody can say, where is the submandibular lymph nodes? Okay, they are located in the midway or mid-halfway between the tip of your chin and the angle of the mandible. So in the midway here, you can feel it, guys, is the submandibular lymph nodes. Sometimes they are swollen and you can feel it. You can palpate it, I mean. So this is a submandibular lymph node. So the rest of anterior 2/3, they drain into submandibular lymph node and into deep cervical lymph nodes. Now, let us talk about the posterior 1/3 of the tongue. Also, they drain into deep cervical lymph node, like the anterior 2/3, which is again important to know in case of there is a carcinoma in the tongue. So where's the expected locations where the carcinoma will be spread? We have a clinically important issue. So you can test the cranial nerve number 12, which is the hypoglossal nerve, by asking the patient to protrude his tongue. Why protrude? Why you ask him to protrude his tongue? Because you remember we mentioned that before a couple of slides, that there is a muscle known as genioglossus muscle. Let me show you again and remind you. This is the genioglossus muscle, which is like fan-like shape muscle that depresses the mid of the tongue and, most importantly, protruded it outside. So you ask the patient to protrude his tongue because you ask him to use this muscle, the genioglossus muscle, that innervated by cranial nerve number 12, as you see. So let us move back here. Okay, so normally you know that the genioglossus muscle that's innervated by this nerve, hypoglossal nerve, I mean, is, that one on the right protrudes the tongue and like push it a little bit to the left. And the genioglossus muscle on the left also protruding the tongue outside and a little bit to the right. So both of them, when the right and left genioglossus muscles are contracted together, they will protrude the tongue normally like this in the midline, so that protruded outside and it will be in the midline. But if you have a lesion or injury to the hypoglossal nerve on the right side, so first of all you will notice sometime like an atrophy and wrinkles on the side of the tongue, which is related to the same injured side of the nerve. So if you have injury to the cut, for example, in the right hypoglossal nerve, like in this case, so the right side of the tongue would be atrophied and become like you will see wrinkles on it on the same side of the lesion. Furthermore, when you ask the patient to protrude his tongue, the tongue will shifted toward the affected side. So we mentioned that we have cut the right hypoglossal nerve. When you ask the patient to protrude his tongue will move toward the right side, toward the affected side. Why? Simply, guys, if you think about it, back again here, so the right side is not working here, right? Because we have an injury, for example, to the right hypoglossal nerve. So the left genioglossus muscle will now effectively work to protrude the tongue, of course, to the outside, but shifted toward the right. So there is no resistance from right side, right? So the tongue will be protruded to the right side. So this is also important. So these are some of our references, and thank you so much, guys. Hope you find value in it. Thank you.